Welcome to another edition of Riding in Cars with Researchers. I'm Dr. Jeff Kingsley, and today we're going to talk about what it's like to be a patient in a research trial. That means I'm talking to you and to me because we are all patients. Either we're patients today or we will be tomorrow. There are tens of thousands of research trials that we could consider as patients. I'm going to give you 4 reasons that research visits are different from a normal healthcare visit. 1, more healthcare. 2, free healthcare. 3, more education. 4, more respect. So let's start with 1, more healthcare. In research, you receive vastly more amounts of healthcare than you do in a normal office visit. We do more assessments. In a normal office visit, your doctor may assess your eczema, dry, scaly skin, and may actually not do an actual scientifically proven assessment, but rather just use their best judgment and move along. In research trials, we commonly use 5 different assessment tools to assure that we know precisely the status of your atopic dermatitis or eczema. In COPD, emphysema, in normal office visits, at best, you may get 1 pulmonary function test a year and maybe 0. In research, we do 1 every quarter, 1 every 3 months. In research, you receive more labs and EKGs, so we know precisely your blood counts, the status of your liver and your kidney function and your heart. Truly, vastly more healthcare delivery in research than you would ever receive outside of research. 2, free healthcare. In research, all of that, everything that I've mentioned, is completely free. I don't even ask patients if they have insurance. It's that irrelevant. There are no copays. The research medications are almost always free, with rare exceptions. The labs, EKGs, physical exams, even entire surgeries are performed for free without even a copay for patients in research trials. All of that research-specific healthcare is paid for by the research itself, and it's a wonderful, wonderful economic model. 3, more education. In normal healthcare, you spend time waiting around in the reception area and then waiting around in the exam room, but you spend about 8 minutes with your physician at best. In research, you spend maybe 5 minutes in the reception area, you're escorted back to a room, and we immediately start. And you're spending time being educated on everything that we're doing. That initial informed consent document when we began taught you precisely what your disease state is. All of those introductory labs and EKGs help teach you the current status of that disease, precisely how healthy or unhealthy you are, how controlled or uncontrolled you are. Not with a finger to the wind, but with good science. This is precisely what's going on. We educate you on the algorithms, the guidelines of treatment for that disease state. You begin to learn what the doctors know. This is why we believe you should be on this medicine versus that medicine, if this type scenarios. And you begin to learn why we believe that this class of medicine we're looking at is the new cutting edge of therapy for your disease state. You spend more time with your physician in that education process, and when you have questions, you'll get answers that are in far more detail than in normal healthcare. It's a phenomenal way of nurturing that physician-patient relationship. And then 4, more respect. In normal healthcare, you don't know what's going to happen at any given office visit, nor do you know when your next office visit will be. In research, from day 1, you know precisely how many office visits you will have, precisely when they will be, and exactly what will happen at every office visit. You will know how much blood work will be done at your next office visit well in advance, if there will be an EKG, if there will be a physical exam. It's really quite respectful. I'm a large proponent of what's called patient autonomy. I believe patients should be driving their own healthcare. I believe patients should have control over how aggressive or not aggressive they want to be with their healthcare. And in research, there's a tremendous amount of patient autonomy, which is the 4th reason I love research. And the 4th reason research is a little different from normal healthcare. So there you go. 1, more healthcare. 2, free healthcare. 3, more education. 4, more patient autonomy, more respect. Thank you very much. As always, follow us on all of these social media platforms: YouTube, Facebook, LinkedIn, Instagram. And as always, thanks for driving along with me. Take care.